So I want to talk today about healthcare in Ontario. As a candidate for London North Centre, the Libertarian Party of Ontario, this is obviously a pretty big issue. It accounts for half the provincial budget, so it's as big a source of tax spending as everything else the government does combined. So I think we need to transition out of OHIP and into private insurance companies and even just direct cash payments of doctors from patients. And I'll give you a few reasons why we should switch away from the current system. So the first is shortages. We've got wait times, and rural communities sometimes have difficulties finding doctors. So it's inherent with socialism, with government paying for a service that should be handled by the market, is you're going to have shortages because it's very difficult to plan and rationally allocate scarce resources, which is why, for most services, for automobiles, electronics, kitchen stuff, books, etc., chairs, you leave this to the market. And with the market, if you have an unregulated market without government intervention, you're going to have it works great for everybody because you're allowed to vote with your dollars. So you can get exactly what you want. Whereas when you have sort of a government cookie cutter one size fits all solution, it doesn't work so well. So if there's going to be any serious talk about tax reform, about cutting or abolishing taxes, we have to begin with reform of our healthcare system. And that means completely legalizing and deregulating a market alternative to the state-provided healthcare system. And I think that's an important transition step between what we have today, which is the mixed market economy with a highly interventionist state that's destined to lead us to socialism, as we transition from that to the free market economy that the Libertarian Party advocates. So a transition step of allowing this untaxed, unregulated, free market in healthcare alongside the public system, and allowing people then to opt out of the public system if they choose, and eventually, as we see the success of the private system and the higher quality of care, the lower cost, we'll do away with the public system altogether and have free market healthcare.